Welcome to Learning Anatomy with Dr. Bakari. In this lecture, I'll be unfolding the anatomy of the left atrium and all the details that you should know as students of anatomy. If you've not checked out my lecture on the right atrium, please kindly go and do so as to keep yourself updated. The left atrium is the quadrilateral left upper region of the heart. We know that the heart is divided into upper region and lower region. The upper region of the heart is made up of the right and the left atria, while the lower region of the heart is made up of the ventricles, which include the right and the left ventricles. So for the left upper region of the heart is where we have the left atrium, just as the name implies. If you look at this image down here, this is the left atrium. The left atrium takes up a four-sided configuration at the posterior part of the heart, and this is what is presented here, because in this image, the posterior region of the heart is shown clearly here. So it takes up a four-sided configuration, and it is this region harrowed in black. It is a quadrilateral left upper region of the heart that is located behind, and this forms the base of the heart. If you remember my lecture on the heart, where I tried to establish the apex and the base of the heart, we said that the apex of the heart, using this image, is directed towards the left, and it is formed by the left ventricle, while the base of the heart is directed posteriorly. And this is what is seen in this image down here. So the base of the heart is formed mainly by the left atrium and a little contribution from the right atrium, but the bulk of it is formed mainly by the left atrium. And this is the left atrium. You can see that a bit of the left atrium is seen to be shown in this image up here, where the bulk of the left atrium is seen at the posterior part of the heart. And what the left atrium does is to receive oxygenated blood from the lungs. Let's go back to the part by which this blood flows. We know that this is the right atrium. The right atrium receives deoxygenated blood from the body, and this deoxygenated blood is released by the superior and the inferior vena cava. As the deoxygenated blood is being released into the right atrium, it is then pushed down into the right ventricle. From the right ventricle, this blood that is deoxygenated and is needed to be oxygenated, and the only place that it will be oxygenated is in the lungs. And this is the lungs located on both lateral side of the heart. We know that we have two lungs, one on the right and also one on the left. And this is where the oxygenation of blood takes place. So the pulmonary artery then feeds the lungs with blood that is deoxygenated, that is needed to be oxygenated. After the oxygenation of blood, the blood is then taken back into the heart through the pulmonary vein. And this is the pulmonary vein arrowed in yellow. We have 4 pulmonary veins. We have 2 on the right and 2 on the left. So these veins then receive oxygenated blood from the lungs. We know that all veins carry deoxygenated blood except the pulmonary vein, and this is where this is established. So the pulmonary vein will then take up the blood that is oxygenated, and the first chamber of the heart where this will be released into is the left atrium, and this is the left atrium harrowed here in white. So as the left atrium receives oxygenated blood, it pushes it down to the left ventricle. This is the left ventricle. From the left ventricle, it is then pushed into the aorta. We know that the aorta is the largest artery in the body, and it is through the aorta that oxygenated blood is supplied to different body organs. So that is how the blood goes. So knowing fully now that the first region of the heart where the blood that is oxygenated by the lungs is delivered into is the left atrium, before it finally pushes through other chamber of the heart, then taken up by the aorta that delivers it to different body organs. So that is what the left atrium does. So let's look at the wall of the left atrium. Generally, we know that the ventricles are thicker in walls than the atrium. The ventricles form the lower chamber of the heart, while the upper chamber of the heart is formed by the atria. If you look at the wall of the ventricle, you see that it appears to be thicker. Then going up to the wall of the atria, you see that the walls are thinner. We already justified the basis behind this in our previous lecture on the heart. The ventricles are responsible for pumping out blood. And what they do on the right side, with the right ventricle, it pumps deoxygenated blood into the pulmonary trunk, while on the left side, the left ventricle pumps oxygenated blood into the aorta. You can see that at the ventricular region, the chambers are responsible for pumping out blood. And for them to pump out blood, they need to be muscular so as to be able to gather the momentum that is needed for this pumping action. And that is why you see that the ventricles are thicker. While in the atria, what they do basically is to receive blood into them. And this does not need to expend a lot of energy to do this, because what they do on the right side for the right atrium is to receive deoxygenated blood from the superior and the inferior vena cava. While on the left side, the left atrium receives oxygenated blood from the lungs. So you can see that what they do at the upper chamber is just to receive, while in the lower chamber is to pump. Then where do we now think needs to be muscular in order to be able to expend or carry out this action? It is the ventricle, definitely. So you see that the walls of the ventricles appears to be thicker than what is seen in the atria. And also, the left atrium appears to be thicker than the right atrium. So if you look at the wall of the left atrium, you see that it is thicker than what is presented on the right atrium. This can also be justified. And this is how it goes. Oxygenated blood that is received into the left atrium, it goes down to the left ventricle. From the left ventricle, it is then being pumped into the aorta that next supply the different organs in the body with oxygen and nutrients. You can see the magnitude of this pumping action and the structures that it will be feeding with oxygen and nutrients. But in the right atrium, where it does is that it pumps deoxygenated blood into the right ventricle. From the right ventricle, it is then being taken up into the pulmonary trunk. From the pulmonary trunk, it will then be used to supply the lungs with deoxygenated blood, where it will be oxygenated. So this is just pumping to the lungs. So for the right atrium, the pumping strength is not as what is needed in the left atrium, because in the right atrium, it is pumping blood to the right ventricle, which then pumps only to the lungs. While in the left atrium, it is pumping to the left ventricle, which supplies the different organs in the body. So you see that the left atrium needs more energy so as to be able to pump blood to the different regions of the body through the left ventricle. But in the right atrium, it's just pumping into the lungs through the right ventricle. So you see that the wall of the left atrium is thicker than what is presented on the right atrium. And we've justified it that it needs higher pressure at the left atrium because it is pumping to feed the different organs in the body with oxygen and nutrients after pumping into the left ventricle. While in the right atrium, it is pumping just to the lungs after pumping deoxygenated blood into the right ventricle. You see that the left atrium is doing more work than the right atrium. And also this is justified by the structural configuration in terms of thickness of the left atrium and also the right atrium. So the left atrium has a thicker wall than the right atrium. So let's go to the external features of the left atrium. If you look at the left atrium on the outside, we've already established the specific location that it is seen. It is seen at the posterior part of the heart. That means you need to tilt the heart to the posterior part for you to be able to view the left atrium. So let's look at the external features of the left atrium. So for the superior region of the left atrium, at the upper part, we have two distinct features or structures that are seen in this region. We have the pulmonary artery. If you look at this image down here, we already said that this is the left atrium. So if you look at the upper part of this left atrium, the structure that you see is the pulmonary trunk. We know that the pulmonary trunk emerges from the right ventricle, where it carries deoxygenated blood to supply the lungs with deoxygenated blood, where it will be oxygenated. And this is the pulmonary trunk. If you look at this image up here, this is the left atrium. The left atrium, we know that is located at the upper left chamber of the heart. So if you look at it above, you see the pulmonary trunk also above it. This pulmonary artery emerges from the right ventricle here to supply the lungs. So above this left atrium, you see that the pulmonary trunk is seen to cross above the superior border. So at the upper border of the left atrium, you see the pulmonary trunk crossing to supply deoxygenated blood to the lungs where to be oxygenated. And in this handmade image, this is the pulmonary trunk. You can see the configuration of the posterior region of the heart. This is the left ventricle at the front, and behind we have the left atrium. We already said that the left atrium is seen at the posterior part of the heart, and it also forms the base of the heart. So this is the left atrium. In the left atrium, if you look at the upper part, we have the pulmonary trunk also in this handmade diagram, and this is the pulmonary trunk arrowed in red. You can see it crossing the superior part of the left atrium. And of course, we already said that it emerges from the right ventricle, where it carries deoxygenated blood to supply the lungs with where to be oxygenated. So going further on the superior part, apart from this pulmonary trunk, another structure that is seen at the upper part of the left atrium is the ascending aorta. And in this image down here, this is the ascending aorta. The ascending aorta is an emergence of the left ventricle. We know that in the left ventricle, we have oxygenated blood that is ready to supply different body organs with oxygen and nutrients. So from this left ventricle, it is then taken up or directed into the aorta, and it is directed into the aorta so as to supply different body organs. So also above or superior to the left atrium, we also have the ascending aorta. In this image here, this is the ascending aorta that is also seen above the left atrium. This is the left atrium here. So you see it just superior to it. And in this handmade diagram, this is the ascending aorta that is coming from the left ventricle, where it's carrying oxygenated blood to supply different body organs. So you also see the ascending aorta at the upper part of the left atrium. So going further, at the anterior region of the left atrium, which means at the front, what are the structures that we see? This first structure that we see is the left auricle. Remember our lecture on the right atrium where we talked about the right auricle, which is an out pouch that is seen to extend in the anterior part of the right atrium. So also we have in the left atrium. The left atrium also presents an out pouch. So this is like an out pouch that is created, just like an outward extension. And this is called the left auricle. It is also referred to as the left atrial appendage. It is an anterior out pouch of the left atrium. If you look at this image down here, this is the left auricle, which is an extension that is created in the anterior part of the left atrium. So you see it as an outward pouch on the external surface of the left atrium. If you look at this image up here, this is also the left atrial appendage. You see it has an anterior extension or out pouch that is created in the anterior part of the left atrium. Another structure that is seen in the anterior part of the left atrium is the left atrioventricular groove, which means the groove that separates the left atrium from the left ventricle. And this is the groove here. We also have this groove created on the right side between the right atrium and also the right ventricle, which is called the right atrioventricular groove. In that groove, when we did our lecture on the right atrium, we said the groove allows for the passage of the right coronary artery, while the groove that is created on the left side, that is called the left atrioventricular groove between the left atrium and the left ventricle, allows for the passage of the coronary sinus. The coronary sinus is the largest venous drainage of the heart, and this is the coronary sinus that passes through the left atrioventricular groove. The coronary sinus is the largest venous drainage of the heart tissue itself. Remember, we said that because the heart pumps blood does not mean that it doesn't need its own blood supply. So it also has its own blood supply that feeds its cells with oxygen and nutrients. So the largest venous drainage of those arterial supply is the coronary sinus. And this is the coronary sinus that is seen to pass through the left atrioventricular groove. On the posterior part, that's behind, if you look at the left atrium behind, the structures that we would see are the pulmonary veins. These pulmonary veins are 4 in numbers. We've already established. We have 2 on the right and we also have 2 on the left. And these are the pulmonary veins that are highlighted in red. The 2 on the right will drain oxygenated blood from the right lung, while the 2 on the left will drain oxygenated blood from the left lung. So that is how they are being established. If you look at this image up here, this is the pulmonary vein. You can see we have 2 on this region, and so we would also have 2 on the other region to supply the lungs on the other side. If you look at this handmade diagram, this is where we have the pulmonary vein. This is one vein, this is another vein. Because this image shows like half of the left atrium, the other half is being chopped off. So the remaining 2 pulmonary veins are not seen in this image. But just for us to know that we have 4, 2 on the right and also 2 on the left. Let's try and divide the internal region of the left atrium into the sub-regions that they are made up of. The interior wall of the left atrium is generally stated to be smooth because the bulk of this surface appears to be smooth. It is just a small region of the left atrium that presents a rough configuration, and that is why it is generally stated to be smooth. We will see the specific region of the left atrium that appears to be rough as we go through with this lecture. So if we try to divide the left atrium into two, anterior posteriorly, we have the posterior half, and this is the posterior half behind. Then we have an anterior half, which is the anterior half that is seen at the front. Then we have the septal wall. So this is like a demarcation that is created between the atria, which are the upper chambers of the heart. The septal wall separates the left atrium from the right atrium. So these are the three sub-regions of the left atrium. We would be taking each of these sub-regions one after the other to see the distinct features that they present. So let's look at the posterior half, which is the region that is located posteriorly. So if you try to divide the left atrium into two, the posterior half is where we'll be looking at first. And within this region, what you see are the pulmonary veins. We already said that there are four. So the pulmonary rings is what opens into the posterior region of the left atrium. And this is how it is presented. Let's say this is the posterior part of the left atrium. So you have four pulmonary veins. You have two on the right and two on the left. Let's say this is the right lung and this is the left lung. The pulmonary veins drain oxygenated blood from the lungs. So we have two lungs, one on the right and one on the left. So they'll be draining oxygenated blood from these lungs and be draining it into the left atrium, because the left atrium is the first region of the heart that tends to receive the blood that is oxygenated, that is ready to supply different body organs with oxygen that they need to undergo their metabolic activity. So what is seen in this region, highlighted in black, are the pulmonary veins. So we have two on the right and two on the left. But before we go into the specific regions of the lungs that they drain, let's try and divide the lungs into the lobes that they are made up of. We know that the right lung is made up of the superior lobe, we have the middle lobe and an inferior lobe. On the left lung, we have the superior lobe and an inferior lobe. So we know the lobes of the lungs. So talking about the specific regions where they drain, we have the right pulmonary veins and the left pulmonary veins. The right pulmonary veins, we have the right superior pulmonary vein. So this is the right superior pulmonary vein. And where it drains are the superior and the middle lobes of the right lung lobe. And we also have the right inferior pulmonary vein. And this is the right inferior pulmonary vein, which only drains the inferior lobe of the right lung. So you can see how they tend to distribute their drainage of oxygenated blood from the lungs. On the left side, we have the left superior pulmonary vein, and this is the left superior pulmonary vein, and where it drains is the superior lobe of the left lung. We also have the left inferior pulmonary vein, which drains the inferior lobe of the left lung. So you can see that they have their specific lobes that they drain. So there are four pulmonary veins that empty oxygenated blood from the lungs into the posterior region of the left atrium. Going to the anterior half, dividing the left atrium into two, the anterior half is at the front. Of course, it's the region that is close to where we have the left ventricle. So the structures that we see in this region include the left auricle. We already talked about this auricle in our previous slide. This is the left auricle, which is an out part or an extension that is seen in the anterior part of the left atrium, and it tends to overlap or overlie the left ventricle. So you see it leaping over it like that, like an out pouch. So this is what is presented in the anterior half of the left atrium. If you look at the interior of this left auricle, you see that it is seen to be rough, and this roughness is caused by the ridges that are produced by musculi pectinati. So the interior is not smooth, it is seen to be rough because of the digitation that is caused by this pectinati muscle. And this is the muscular pectinati that is seen to line the interior of the left auricle. So this is the region that appears to be rough within the entire configuration of the left atrium. And that is why we established that the interiors of the left atrium is smooth, except for specific minute or small region. And it is this region that presents that roughness. This is what is presented in the anterior half of the left atrium. If you go more inferior, we have the vestibule. This is the vestibule. The vestibule is the region that finally opens out into the left ventricle. We have the bicuspid valve or the mitral valve, and we know that that this is a two-leaflet valve that is seen on the left part of the heart that tends to separate the left atrium from the left ventricle. So around the vestibule, we have the opening into the left ventricle, and this is guided by the bicuspid or the mitral valve. And if you look at the configuration of this valve, you see that it is bicuspid because it's a two-leaflet type of valve, and that is why it is so named bicuspid valve. So this is what is seen around the vestibule of the anterior half, while at the upper part, we have the left auricle, which is the out part that is created. So you can see that the different regions of the left atrium has its own distinct presentation. They're going to the septal wall. The septal wall is a barricade that is created between the right and the left atrium. We've already said this. So using this image up here, during the development of form, there's a pattern by which this septum is created between the right and the left atria. This septum is a doubled walled septum, which means that it is made up of two layers. On the right side, this is what is formed, and this is called the septum secundum. This septum secundum forms the atrial septum around the right atrium, and this is what is seen here. Because we say it's a double wall or double layered septum, on the left side, we have another septum that also contributes to the formation of the interatrial septum, but of course within the left atrium, and this is called the septum primum. And this septum primum, it is seen within the left atrium. So within the right atrium, what we see is the septum secundum, while in the left atrium, what we see is the septum primum. So these two septa have foramina within them. These foramina are so created to allow the passage of blood from the right atrium to the left atrium, so as to bypass the pulmonary circulation at this stage of development. During the developmental process, the pulmonary circulation is yet to be established, so blood is taken directly from the right atrium to the left atrium. So the foramen that is created on the right side is called the foramen ovale. In our lecture on the right atrium, we already talked about this foramen ovale, which will later become a depression that is seen on the right septal wall within the right atrium, and this is called the fossa ovalis. This will become the fossa ovalis after developmental process. Also within the left atrium, we also have a foramen that is created on the septum primum, and this is called the foramen secundum, and this is the foramen secundum. This foramen secundum we also transform to become another structure after developmental process. So let's take this knowledge down here, looking at the gross configuration of the interatrial septum within the left atrium after developmental process. So this then leaves the septal wall of the left atrium with two distinct features, and this include the concave semilunar fold. This is the concave semilunar fold. This fold is seen as a concave fold within the septal wall. This is formed by the septum primum. We know that the septum primum is what barricades the left atrium from the right atrium during the developmental process, but this is just seen around the left atrium. So this is what becomes the semilunar fold that is seen in the septal wall of the left atrium. If you go above the semilunar fold, you see a lunate-shaped fossa that is called the lunate fossa, and this is the lunate fossa that is highlighted in black. This is seen above the semilunar fold, and this is formed from foramen secundum. Remember, we talked about foramen secundum, which is an opening that is created by the left septum primum, which is one of the septal layer. So this is called the lunate fossa. So let's look at clinical anatomy. And remember, this is the left auricle, which is an out pouch or an extension that is created in the anterior half of the left atrium. This out pouch is a potential site for the formation of thrombus, which is blood clots. Because of the roughness that is presented within the cavity of the left auricle, remember we said that generally the wall of the left atrium is seen to be smooth, except this region that appears to be rough because of the deposition of muscular ridges that is formed by the pectinati muscle. So because of this roughness, this site is prone to the formation of thrombus or blood clots, and this can lead to cerebral embolism, renal embolism, or even systemic embolism, which are blockage of vessels that supplies the cerebral region, the renal region, and also the general systemic blood supply. So this can lead to blockage of the arterial supply of the different regions in the body. And what can be done to rescue this situation is the use of anticoagulants or surgery so as to remove the blood clot, or ligation to remove the occluded region. Let's check our understanding of this lecture through the following questions. And the first one is to describe the external features of the left atrium. The second question is to explain the features on the septal wall of the left atrium. And the last question is, how many pulmonary veins are there? Highlight the lobes of the lungs that they drain. Thanks for watching. Let's meet again.